My name is Mittie Dragosljvich. I go by Dr. Drag, make it a little easier for my patients. Sometimes it's a little intimidating try to get that whole string of words out at one time. I'm a radiation oncology physician here at Cox Branson. What that means is I use radiation treatments to treat patients with cancer. I did my medical school training. I attended in Philadelphia at Hahnemann University. I did a year of internship internal medicine at Shadyside in Pittsburgh, which is part of University of Pittsburgh. And I completed my radiation oncology training at the Cleveland Clinic in Cleveland, Ohio, and at Hahnemann University in Philadelphia. We provide all the cancer care services for radiation. So that means evaluating the patient, diagnosing the patient, ordering tests, imaging, whatever is necessary to diagnose and stage a patient with cancer. And then we sit down and review those results, formulate a treatment plan, and then implement that treatment plan. And my part of it is basically doing the radiation treatments. I was drawn to radiation late in my medical school training. I was initially interested in going into diagnostic radiology, which is performing and interpreting diagnostic imaging such as CT, MRI, PET scans. What was lacking from that part of it was the patient interaction. You didn't have any direct patient care. So I had a very good friend of mine in medical school that did a rotation as a medical student in the radiation oncology area. And we had a very prominent service at Hahnemann because the chairman there was one of the lead editors of the standard textbook that was used for radiation. So that kind of got me interested in it. So I did a rotation during my senior year in medical school, and then changed from a diagnostic radiology going into radiation oncology. So that gave me kind of a blend of direct patient care, interacting with the patients when they're first diagnosed, patients and families, evaluating, working them up, and then there was still the diagnostic part of it where you had to order and interpret imaging to stage a patient's cancer to determine what is the proper treatment. And then we get to use very advanced technology to design a treatment program. And then we interact with the entire treatment team, which includes the nursing staff, physics, dosimetry, and then our radiation therapist to implement that plan. And as the teamwork that's involved was always intriguing to me. A lot of specialties can get too specialized where you're just dealing with a very specific aspect of patient care. And we pretty much have to take care of the entire patient individual, as well as family situations, social situations. So it's never boring or routine is definitely what I can say about radiation oncology. I've always liked smaller communities. I grew up in a small community north of Pittsburgh, Pennsylvania, and went to school in large cities, Philadelphia, Cleveland, Ohio, Pittsburgh, Ohio for training, and then back to Philadelphia. But I still found myself drawn to the smaller communities, and in many of them they did not have these services available and would often have to travel long distances. So when I took the position here at Cox Branson, that was the exact situation. Patients from even North Arkansas were driving by Branson to go to Springfield to get cancer care services, including radiation oncology. So the administration recognized this need and had the vision to invest in a cancer program here in Branson so that the patients locally could stay locally and get their care. Radiation is different than a lot of other areas in medicine. We do daily treatments, sometimes for as long as 8.5, 9 weeks of daily treatments, Monday through Friday. And so having to travel that kind of distance would put a big hardship on many families and patients. And I chose the Branson area primarily because it reminded me a lot of where I grew up, and it has a very scenic and lovely area and in 4 seasons. And then the patients here were bypassing Cox to drive to Springfield to get their cancer care. So this was an opportunity, I think, that they were wise in investing in the future and having this cancer facility built here in Branson. Well, I'm an outdoors type person. That's one of the things I liked about the Ozark. It reminded me a lot of where I grew up with, the hills and mountains and valleys and all the creeks running through the area. So getting out hiking, and I like to hunt. So those are things that really drew me to the Ozark area.